Welcome students for the open elective. Course title is First Aid for All. Today in the session we will be taking Unit 2.1 and 2.2. So I will be giving a gist about 2.2, just a starting, so that we can take in the elaborated version in the next session. So let's begin with the session. Your learning outcomes will be: first, you will be able to know what to do in the first aid when you have anything witnessed as cut, bruises and bleeding. And in next session, you will be getting to know about the road traffic accidents and the fractures. So what you as a first aider can do on these scenarios. So let's begin with students. So let's start with the introduction. So cut and bruises are nothing but a kind of a thing which objects penetrating to our skin which can cause the cut. So this is how the cut will look like, as it is very common in the kitchens and most of the whatever mechanical works we do, it's very common in that. So depending upon the depth of the cut, then often it bleeds out. So if the cut is way too deep, the bleeding will be more. So as per that, what kind of first aid we can able to give to such persons. And about the bruises, if you can see on the left hand side there is a photo. It's just nothing but a blunt trauma in contact with the person or an object can cause the bruises. So let's go with the in depth of it as a first aider, what you can do in such situations. Let's begin with the first aid on cut, bleeding and bruises. If you can see in a picture depicted here, there is first and this it is shown apply the pressure with hands. So wherever you feel a profuse bleedings are there, first and foremost role is to just put the pressure on the wound. Make sure your hands are sterilized, or if you are able to put in a clean and sterilized cloth put over that particular wound, you will be able to reduce the bleeding. So apply the dressing and press it up. So put a clean cloth or the gauze over this particular wound and press it up. If you can see in the third, they are applying a tourniquet. Tourniquet is nothing but it's kind of a belt-like subject, something. So where you are bleeding out, just put it above the joint point. So what will happen from the above, the blood supply will be limited to that area. So in order to reduce the blood flow or the blood loss via cut or bleeding. Let's begin with the next one. What to see and inquire in. So, if it is an open wound and there is a profuse bleeding, so first and foremost thing, if the bleeding is profuse or not, you need to check that. Whether there is an object stuck inside the wound. So if you want to see if you are not able to see the wound or the stuck inside any objects are inside the wound, you need to check that out as well. Next is if the patient is feeling or the person is feeling way too much pain on that particular area only, then you can suspect that there is an object inside the wound. If the patient or the injured person is revealing that there is a painful lump, that means just a kind of a bump kind of thing and they feel like it is painful, then you can suspect that there is something inside the wound. And the third one, if they feel the patient or the person himself is feeling that something is stuck inside the wound, then we need to be pretty much sure and be careful with that particular wound. The D, whether we are finding any kind of a discoloration in that particular area where the pain it is. So this is how where we find out whether is there any other object stuck inside the wound or not. If you see something, if it is wound, if it is cleared out, so we have tried to make sure the bleeding is stopped. If the bleedings are not stopped, the person or the patient can bleed to death. So make sure if you are seeing something, let's do something on this. As we have already spoken about the open wound, let's go about the bleeding which are there inside. The internal bleeding we can't see on with our naked eyes. So there are few symptoms which I have jotted down here, which will be helping you, us and everyone to know whether the bleeding or the suspect or the patient or the person is bleeding from inside or not. So first is whether he or she is losing blood from the body cavities, either the nose, mouth, or any kind of a sex organ or the anus. Any kind of area if they are losing the blood, then we can infer that the patient might have the internal bleeding. Next one. is whether the patient or the suspect or the person is breathing rapidly or not, whether their extremities, that means the hands and the legs, are in cold, if the skin has turned into pale or in bluish color. So these all are the suspect that patient is losing the blood, whether the heart rate is rapid or not, whether the heart rate or the pulse, you can check any one of it, whether their behavior is very much unusual and very irritated or not, and then whether they are complaining about the tenderness over that area and even the swelling in the abdomen or chest. If they are telling any kind of complaints like that, then we can suspect that it is an internal bleeding. And last one, if because of the profuse bleeding internally and which went without diagnosis, they might lose consciousness because of the blood flow. When this is the most important part, if the patient, if you feel that there is an injury in their leg and which is internal injury, please do not raise their leg because it can aid to more do the blood flow or bleeding inside internally. So please, if you suspect it, please do not raise their leg. So let's start with what we should do during these conditions. First, we have inquired already, so now let's start with the first aid procedures. First is safety first and call for help. This will remain unanimous for no matter what is the condition. First, make sure there is no danger to you and to the person. Make sure the area is being cleared out without any danger, then you can approach. Then next is call out for the any kind of facility or even for the ambulance, or depending upon the condition or situation which whom you are calling to. Please don't leave the patient or the person unattended. If bystanders are there, please ask them to do it. Provide the first aid. How you will provide the first aid? First, make the person very much comfortable in the position. Either it can be lying down, or if the patient or the person is not able to lie down at that particular moment, please make them in a proper situation, position, that is just lean on the wall. So with that, he will be in a very comfortable position and you can work on your first aid. Loosen up any kind of tight clothing if they are having up. If the injuries are there, please cut it off or loosen it up. If it is a shirt, please take off one or two buttons so that the patient feels relaxed. Arrange any kind of a transport urgently to the hospital and also observe the person till in case he collapses. Until the ambulance reaches, you need to make sure you have an eye on the patient or the person. Before touching the patient, first and foremost thing which is very important is your hygiene. Please don't forget it, because any kind of application or any kind of contact with the body fluid of the other patient or the person to you might cause any other conditions as well. So make sure you are pretty much clear about the hygiene. So first, make sure your hands are cleaned, washed, and it is sterilized. Okay. So you can even work with any kind of sterilizing agents with you. So if you have gloves with you in your first aid box, please use it. And once you keep all the gloves on, just sterilize it and then you approach to the patient. Now, how to stop the bleeding? You as a first aider, how you can stop it up? First, just ask the patient to be in a comfortable position. Then, once you just let them know what has happened and what you're going to do, so that they are calmed down and they are not moving so much. In case if it is profuse bleeding, if the patient or person moves so much, they can also exert in the they will be act as a catalyst to even more bleeding. So make sure they are in a comfortable position and as calm as possible so that you can do your first aid. Try to slow down the bleeding by pressing over the wound with a clean bandage or the cloth. Pressing up to the wound area, giving the pressure over there can relatively slow down the bleeding. In the previous session, I have mentioned about making bandages, clean cloth, gauze, everything in your first aid box. If it is there, it is really, really well. It will work like a magic. So alternatively, if the patient is alert, so please ask them to press over the wound. That can also be possible. So this is a wound where there is a bleeding, and you have a dressing as well attached to the bandages. So you can put that particular bandage dressing over the wound and bandage along the areas of the wound, so that in order to reduce the bleeding. So this kind of a dressing attached with the bandage, if anyone is carrying or if you are there in your first aid box, it will be well and good to reduce the bleeding. So if you don't have it, please cover the wound with a clean piece of cloth, cotton cloth preferably, around the wound. If you don't have the bandage, try to get another material just to make the pressure over there. So if you have bandage, please put the bandage over it and a little bit tighter just to slow down the bleeding. And just apply the pressure over that areas until the bleeding has been stopped. Make sure when you are putting the bandage, they are not firm enough to stop the bleeding. If it is that the condition, then it can worsen the condition of the patient. So make sure when you are putting the bandage, it is not so firm enough. In case if you feel, if the patient or the person is complaining about they don't feel anything in their distal arm, they don't feel anything, their colors are changing, its color changing into bluish or the pale color, please loosen up the bandage a little bit, but do not remove it, because you have already tightened it and kept so that the bleeding has been stopped. If you try to remove it, the profuse bleeding will go in an overflow, and even the patient will be having a random amount of blood flow over there. So make sure you are not removing it, you are just loosening the bandage and you are wrapping it up again. Hence, the flow of the blood to the limbs has been stopped. The injured person can also lose their limb because of the discoloration. If you feel all these color changes are there, please loosen up the grip of that particular bandage. But in this case, please do not apply any tourniquet at this moment to fix the bandage. So, at this special cases where only the bandage can help, you can use only the bandage at this moment, not the tourniquet. With this, you can send the patient or the person to the ambulance, and then they will take it back to the hospital. I hope the first aid to the cuts, bleeding and bruises are being clear. So let's move to the brief about what you can do as a first aider in case of fractures. First aid in fracture. So in this particular session, I will just give you a brief about what you can do in the fractures. But in next coming up session, I will give you at one areas if you have any kind of fractures in your hand or it is in the leg. So what you can do on this situation. So here is just the generalized version what you can do in terms of if you see a patient or the person with a fracture. So let's begin with. As you are now clear with the fractures and its causes, let's move to what we can do and inquire when you see any kind of a fracture case. So let's begin with. What you need to see and inquire in such kind of situation. If there is a signs and symptoms, if you see and observe in a patient who suffer from a fracture. In this particular GIF, if you can see a deformity here. If you can see, you look down here. So his on the knee, below the knee part has been deformed. So that is one significant symptoms where you can see that the person has fractured. So if he is complaining about very severe amount of pain on the spot of fracture. So we can inquire or we can spot that it might be a fracture. If he has a lot of tenderness are nothing but pain while touching to the injured spot. If it is way too much, we can suspect it. If there is a very immediate swelling over that particular fracture area, swelling means it will be within minutes after the impact. So if you can see an immediate swelling in that area of the injured area, you can suspect that the person may have fracture. If in case of the bleeding, This may be applicable, may not be applicable, depend upon the cause of. Otherwise, what is the mechanism of injury, or to that part it will depend upon whether the bleeding will be there or not. If the bone is sticking out, sometimes the wound will be open and the bone after the fracture will come out of the skin. So that time also we can make sure that the person is having fractures. There might be a discoloration over that area. You can find a bluish color, just like how it will be a bruises, just like that color where you can see that it has been a clot over there. Last but not the least, it is the abnormal loss of movement. Whatever movement to that particular joint was it, it was compromised. So all this above listed pain signs and symptoms are the one who ensure or tells whether the patient is having suffered a fracture or not. So let's begin with what we can do if we are in such type of situation and we are witnessing a situation like that. First and foremost thing, what we have to do, it remains the same for every other situation. First, your safety and call for help. Make sure you and the other persons are not in danger. So make sure you are taking the another step, that is call out for help. But in this case, please do not leave the patient or the person unattended. You should be there to make sure the patient or the person is telling you something and you are in the receiving end. So you are there to monitor them. Please do not leave the patient. If the bystanders are there, please tell them to arrange any kind of facilities and ask them to confirm it with you once it is secured. Next and foremost thing is your hygiene. Again, make sure your hands are being cleaned out, you are sterilized, you are using any kind of sanitizers, it is well and good. So you can use gloves to protect yourself. You should not let any kind of bodily fluid getting in contact with you. So make sure these are the important aspect. If whatever it is, you need to do these two at the first place. To provide the first aid. After all these things, what you need to provide. So fractures we can see in a major accidents area. So first and foremost, it's the injuries should be treated first. So if you feel like the patient is not breathing or he is not able, you can't see the pulse or something, you have to provide with CPR immediately. And if there is a fracture, you can see one or other spot as well in that one particular limb. If it is a hand, you can see multiple fractures in the same point. So you need to make sure that you are very pretty much sure about the areas of fracture and you are not moving it deliberately so that it should not be worse. If you suspect there is a fracture, please do not move that broken area or dislocated limb unnecessarily. If you do any sort of aspect like that, any kind of movement can even worsen the condition. So ensure that you are not moving that area. Second important thing is please do not move that patient or the person until the injured area or the fractured area has been secured and stabilized properly. Until and unless, don't move these people around anywhere. Third important part is carefully when we are turning in him or moving him from one side to another side, make sure you are very much careful about their position of the hand or the leg, wherever is the fractures. You should make sure that you are very much careful while you are moving them. Next, an important point is you have to reassure the casualty or the patient or the person. You should make sure they are knowing what you are doing and you have their full confidence which you have already gained. Next is advise the person to be very calm. Unnecessary movement can also worsen the condition. So make sure you are telling all the pointers correctly to the particular person. If the casualty is not able to move his arm, if you feel like there is any kind of injury to the shoulder, please give him the triangular bandage, which was this, which I've already told you about the previous session, to make a triangular bandage, keep in your first aid box, or you can even make it up. So at least with that particular thing, the shoulder has been supported and it is not moved unnecessarily. Arrange appropriate transport to the nearest facility. This is an important aspect. The patient or the person or the victim has to be getting any other medical attention immediately. So in case of this, you have been immobilize the particular area, and you have successfully placed them in the ambulance and you have let them go to the medical facility. This is what you as a first aider can do in case of a generalized first aid like a fracture cases. So in the next sessions I will be taking up for the specific area, for the upper limb, that is over the hand, over the leg. So those two fractures will be covered, and how you are able to stabilize it and let them go to the hospitals will be covered. Thank you students for this session. I will be looking forward for our another session where we will talking about the fractures in detail. Thank you so much.